Good evening, my name is Nicholas and I'm here with Dr. Shahrudin from the Selangor Specialist Hospital Syndrome Berhad.
Yes.
And their public brand being KPJ Selangor Specialist Hospital. Without taking too much time from Dr. Shahrudin,
Yes.
please let me invite this esteemed persona here to tell us a little bit about the business and how you use the branding of the business to promote healthcare for Malaysians.
Actually, as you are aware, the KPJ name itself is now a brand
Yes.
synonymous with private healthcare in Malaysia. And we are one of the many private institutions that are active in treating patients in Malaysia. KPJ Group as a whole has 19 hospitals.
19 hospitals.
Yes, in Malaysia and 2 overseas in Indonesia at the moment. And the group as a whole is expanding into other parts in Malaysia where private healthcare is not easily accessible yet.
Will we be talking about rural communities?
Yes, the latest member of our group is from Sabah Medical Center, which has joined our group just a few months ago.
Right.
And there are other hospitals actually being built at the moment.
I see.
5. One is in Muar, and one is in Pasir Gudang, another in Iskandar, Malaysia, Iskandar area, and the other one is in Klang.
I see. Muar, Pasir Gudang and Klang.
Yes.
Now, correct me if I'm wrong, Dr. Shahrudin. These 5 hospitals that you mentioned, would it be under the new addition to the KPG group? That is
Yes, that's
Sabah?
right. The further addition, which
I
means
see.
that we will increase the number of hospitals to 24.
I see. So in terms of expansion, in order to facilitate or accelerate the growth of the KPG brand, would you be absorbing more medical associations or groups into your company?
Yes, actually it's a win-win situation with the situation in Malaysia, and you are aware also the global changes in healthcare. A big group would actually be performing better than a standalone hospital.
So we're talking about partnerships and strategic alliances.
Yes, that's right.
I see.
Especially with a brand name that we can sell. KPJ is synonymous with quality and healthcare. And in healthcare business itself, there are also accreditation processes.
Accreditations.
That's right.
Just like in the education industry.
That's right. Where the independent body in Malaysia is the Malaysian Society of Quality of Healthcare. Just like GCI that we know internationally, in Malaysia we have the Malaysian Society of Quality of Healthcare, which award accreditation to various private and government hospitals.
I see. So it covers both private and government institutions.
Yes, that's right.
I see.
And I can do that because as a board member of MSUH, we do that. We make sure that the hospitals, be it private and public, be at the same level, providing same quality and safety.
The question is this, Dr. Shahrudin. How do you reconcile the obvious medical quality services in terms of how it differs from the public service with the private service? Because the public perception is that private service is higher cost as well as higher quality.
I think we must correct the perception of public first. Both sides of the healthcare services aim at providing best healthcare to the country, irrespective whether people can afford it or people can't afford it. And even in a private institution, of course, people always associate private healthcare with high cost, but we as a private institution has a responsibility, like corporate social responsibility, where we give back whatever that we give back a portion of what be given to us by the public, and we share it with everyone.
I see.
And actually, we have our doctors providing services where it's complementary because certain areas the services are just not available.
I see. So it would be correct to assume that KPJ is predominantly in the private sector of healthcare.
It is in the private sector.
But you seek to cater to a larger audience of medical needs.
Yes, that's right.
I see. So may I ask Dr. Sheridan, how do you wish to, or how do you see your brand leveraging upon the reception of this award tonight to further your brand to reach a wider audience, or rather to reach a wider market segmentation?
Of course, we have many awards as a KPJ, as a group, many awards. For example, as I told you before, in the healthcare itself, we have the accreditation. But it is also equally important to highlight, that medical expertise is just like any kind of business. We have a product to sell, we have a service, we must excel it, we must show that we can perform.
So there's a certain
quality
service level agreement.
That's right, yes. So we like to share, because certain things, like for example in our hospital, KPJ Selangor, when we introduce certain new small innovations, for example, like the buggy service, where we assist patients from getting their car when they are in the parking lot, because the parking lot is big and patients, not all patients can walk, and we actually have a buggy service that moves around, that as a patient,
like in a shopping mall.
That's right. And as they park, we will bring them to our foyer.
I see.
Or lobby.
It's almost like a ambulance stretcher service, but for everyone.
For everyone.
For everyone.
Actually, that helps all, and people are very happy with that. And the other thing is to improvise a one-stop discharge center at the ward itself. Like, when a patient is discharged from a hospital, the usual process that we practice is the patient will go down to the admission and discharge.
Yes, it's very administrative in process.
Right, administrative process. But we cut that short. We bring the service to them. Our clerk and admin officers will discharge the patient from the ward itself. That means once the patient walk out from the ward, they just go straight to their car.
So once you're ready to leave the hospital,
that's right,
you don't need to go around
to many places. Even we bring their medications to them, their discharge medications to them. So these sort of small innovations make us better.
What we call service innovations.
That's right, yes.
More so than medical innovations,
yes.
Of which I'm sure the KPJ will keep up to date of as well.
That's right, yes.
Fantastic. Well, it's been a great time talking to you, Dr.
Yes.
And I think you've really opened my mind as to how far private service medical healthcare can offer to Malaysians.
And I hope one time you can come and visit us, even though not as a patient, but just as a visitor. And
can I look
show
for you personally?
Yes.
Yeah? Can I look for you personally?
Can, no problem.
Because from this interview, I can tell that you're a very, very friendly person in nature, even though you have to look over such a huge corporation of hospitals.
Yes, sir. Okay.
It's been a pleasure.
Thank you very much.
All right.
Thank you for the interview.
Definitely.
Okay.